Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, symptomatic therapy for Parkinson's disease. So, for Parkinson's disease, if the patient with Parkinson's disease develops nausea or vomiting, we can use domperidone. If the patient presents with psychosis, then we can use clozapine, quetiapine, and pimavanserin can also be used. If the patient presents with abrupt withdrawal, then we can use neuroleptic syndrome can be used. If the patient presents with abnormal coriform movements, then we can treat the patient with amantadine. So if the patient develops abrupt withdrawal, then we should think about neuroleptic syndrome, and for psychosis we give clozapine, quetiapine and pimavanserin.
thank you and thank you for watching.